Go mute.
Perfect. All right, let's see. Share the proper screen here.
And Megan, you have my bio, right?
I do. Are you able to see the slides that I've got pulled up, Dr. Ambar? Perfect. All right, everybody,
Yes.
welcome to CEP Live. We've got our tech stuff started, so we're off to a good start this weekend. And hopefully some of you are joining from Brain Talk Live, our previous education session with the Brain Health Center. And you know, at the Emory Cognitive Empowerment Program, we want to commit time each week in our webinars to bringing you all of the research that we've been doing the past 3 years. And we have a lot of people who come into the program and do their own research projects and really kind of want to know, what are the lifestyle interventions? What are the changes that we can do in our lives each day that help with memory and health and brain health? And that's what we'll be talking about this week. You know, the Cognitive Empowerment Program is all about offering lifestyle interventions that are doable. And we also want to kind of go backwards and give you the why. Why do we recommend these lifestyle interventions every week? Why do we recommend that you work out and do the mind diet and have Mediterranean foods in your diet and things like that, cutting down sugar? Why do we recommend that you lower your stress? And that's going to be one of the things that we're talking about this week. How is stress correlated with brain health? And so tune in. We've got some information that's being offered to you guys on the screen. We've got some Q&A functions if you want to join in on the conversation and ask questions during the presentation. If you're interested in joining some of our in-person programming, our year-long in-person research study, we've got some information you can take a picture of with your phone. And every week we record our sessions, we post them on YouTube. So don't feel like you have to write down all the notes with the quickness. We'll post this session right after we get done today, and it'll be available for you on YouTube. And I'll share all those links in the chat as well. So we'll give everybody just one more moment to log in. It looks like we've got some good attendance this week. And this week we're going to be sharing with Dr. Ambar. He's going to be coming in and offering a lot of his research. So give us one moment to get everything kind of set up here. And I want to go ahead and introduce our guests this week. Dr. Ambar Kulshreshtha is going to be coming to us as an associate professor in the Department of Family and Preventative Medicine here at Emory University. And he did his research or his residency training and PhD in epidemiology here at Emory. Prior to that, completed his master's in public health at Harvard University and did medical school training in New Delhi. And so we're so excited and we're so honored to have someone here who's interested in health disparities and the prevention of heart disease and dementia. And we know that it's possible. We know that these things are preventable. We know that there's lifestyle interventions that are available. And he's published several papers in high impact journals such as Stroke, Circulation, and JAMA. He's gotten funding from the NIH, different international nonprofit organizations. And he's working on a few health innovation grants. And at CEP, we're about innovations. What's the latest studies? What are the latest interventions that are available? And right now, his grant is from the National Institute on Aging, and it's focused on lifestyle interventions for Alzheimer's disease prevention and the role of preclinical biomarkers. He's a member of a lot of different scientific committees and national organizations, such as the American Heart Association and the Alzheimer's Association, who we refer to all of the time. And regionally, he served on board members for the Georgia Health and Family Alliance, all kinds of different community services that offer healthy practices and access to care for underserved communities. And here at Emory Healthcare, he has led quality improvement initiatives related to telemedicine and primary care, beyond all his work in clinical and research responsibilities. He's a teacher and has mentored lots of students in medicine and public health. So we're so honored and we're so excited to have you here, Dr. Ambar. And we're just going to go ahead and let him pull up some of his slides as we get started. Thanks for coming in. And I hear that you're also going to be doing some in-person studies with us at CEP and some online studies that people can participate in virtually. So hopefully you'll share some of that info with us as well.
Awesome. Thank you so much, Megan. It's my pleasure to be here. I've actually given a few talks at Brain Talk Live, and I think I recognize some participants from there. So that's very exciting. So, I wanted to start my talk, but, we're going to be talking a little bit about stress today. So as I pull up my slides, how about we do a quick poll to see where people stand with their stress levels. So if from a scale of 1 to 10, 10 being the most stress you can imagine, where do you feel your stress levels are today? So go ahead and put it in your chat and let's see where that goes. All right, so I can see a lot of numbers above 5 here. So 6, 7, 3, 6, 7. And currently you can even 84, is that 4? Okay. All right. So definitely this is a topic of interest because I think it resonates with all of us. If I rate my stress level right now, it probably went from before the presentation from a 4 to maybe a 6 now. So, we are all prone to stress, and how we cope with it and what we do with it is, I think, what matters, and which is what I'm going to be talking about today. So as Megan mentioned that I'm a primary care doctor. I see patients and I frequently advise them about changes in lifestyle and things like that. But if I don't understand what they're going through, how they're coping with their day-to-day stresses, I'll be pretty ineffective in my role as a primary care physician. So as Megan said, why do we want to understand this? And I'll share some of my motivations to understand this topic better and what led me into this journey of understanding the role of stress in brain health. So I think we are kind of aware of where is dementia, and it's more like a syndrome where Alzheimer's being the most common one, followed by vascular, then Lewy body dementia, and the other kind of dementia like the frontotemporal ones, right? So we think of this as a syndrome with a collection of symptoms and with a lot of behavioral and psychological symptoms that happen to participants. And I just mentioned that Alzheimer's is the most common cause, but as you can understand, that a lot of times we see more like a mixed dementia picture, that some of it can be reversed through taking care of our risk factors as well as lifestyle. A very small proportion of these dementia cases are really not reversible. So, that is, we're going to focus our attention on Alzheimer's and vascular dementia. So what is the motivation of my talk? It's again, and the research of why I went into dementia research is of how big this problem is. You can see the number of adults with dementia sits at 6.5 million, as projected to go up to about 14 million in 2060. So you are probably all familiar with these numbers as you have been attending Brain Talk Live. as well as other talks done by our Brain Health Center. It's the sixth leading cause of death, and you can imagine the cost of this disease is enormous. Not only are we looking at costs for the patient, but also the unpaid care that goes into the care of these patients and other resources that are required. And I find it fascinating because it's one of the causes of death among the top 10 causes that I'll briefly discuss. That has really no effective treatments as of now, right? We have maybe 2 agents that mildly slow the progression and mostly related to symptoms, but there's nothing like a disease modifying agent that we are really prescribing to our patients right now. There's a lot of great research coming out in this area, but it has still yet to make it to our clinics. So the other motivating topic besides this growing problem of dementia epidemic is the health disparities that are associated with this, right? So we can see this, this graph which shows how African Americans and our Hispanic colleagues and American Indians seem to have a disproportionate burden of Alzheimer's dementia. And African Americans are actually 2 times more likely to develop dementia. And that is kind of troubling as to why that is happening. And a lot of research being done at the ADRC as well as other places is trying to answer this question. So when we talk about the leading causes of death, which I briefly mentioned before, this is how the United States picture looks like, with heart disease being the number 1, cancers, accidents, lower respiratory diseases, and Alzheimer's is there at number 6, right? So when we actually look at what is the real reason why some of these conditions are there, one of my colleagues at the School of Public Health did analysis, and it turns out a lot of it has to do with lifestyle. So a lot of these sort of end, when we end up with these diseases, actually because of lifestyle. So I was very interested because, there's some things like our genetics we can control, but what can we do with what we have and what we can modify? And that to me is a very powerful way of addressing a lot of these chronic conditions. And as I mentioned, I'm a primary care doctor. I really care about the overall health of my patients. I don't want them to have any disease. I want them to be healthy from a heart perspective and a brain perspective, right? So I want to work with my patients as well as in this area of research, focusing on what can be done with things that can be modified and that can actually address a lot of these conditions. So this is something regarding dementia that a lot of research over the past few decades has explained us, right? And I mentioned in the title of my talk that this is about a life course. It's not about that before the age of 70, we're trying to modify all our risk factors, but really things begin to start changing at a much earlier age. So you're really looking at a lifespan of promoting your lifestyle, which means that not only is this kind of a talk, which I actually love giving, not only to my patients, but actually I go out in community churches, and I feel that's the most thrilling part is some of these patients have actually not seen a doctor in a long time. And particularly people in midlife and young adolescent, they don't like to see a doc. And I feel like I want to get the message out there because the lifestyle modification doesn't start at the age of 60. It starts at whatever age you can and you should do to promote lifestyle, right? So this entire span of unhealthy diet, smoking, alcohol misuse, depression, this is all across the lifespan from young adult life to midlife and late life, right? And research is just proving this again and again. Yes, you might start out with some risk genes and some family history, but there's a lot you can do towards your entire life course that can actually make a difference. As you can see, education is a big part of it. And all of these protective factors, such as like education, physical activity, cognitive and social activity, actually help to enhance the brain reserve later in life. So if we can focus more on this and avoid the risk factors, we are going to be in better shape. And as researchers, that's what we are trying to prove is your Alzheimer's disease risk is built all across the lifespan, and it impacts inflammation, oxidative stress, and all these other biochemical things that happen in our bloodstream and brain that actually makes some people develop dementia and others that don't develop dementia. So this life course approach is what fascinates me, because it's the journey towards good health really starts at any age. And if you have better life during even in your childhood, when you are eating right, and I have small kids, and we particularly pay attention to the fact of what they are making in terms of food choices, because that will kind of decide their health trajectory in a lot of ways. So if things are suboptimal, people will tend to have a faster decline in their health compared to an ideal life course. And a lot of these things that are around an environment do make a difference, right? It is our living conditions, our neighborhood and communities. That's why I really love any kind of policy changes that go into our, building more parks or having more physical activity places for our people and getting healthy choices for food. Because all of this really starts promoting health in a very seemingly small way, but that actually impacts a lot of people and has very good returns. So this slide kind of shows what percentage of dementia is actually modifiable. I talked about this earlier, and it gives me hope that yes, okay, we don't have a great drug right now that can be a disease modifying one, but we do have what we can modify, and 40% of it is modifiable, which has been done through a major study that came out in Lancet, and they aggregated data from a lot of these risk factor studies done all over the world. And you can see how things that are potentially modifiable at early life, if you can get more education, that can be something that can help improve your risk for getting dementia. And at midlife, hypertension, obesity, alcohol use. Hearing loss is a big one over here, because it seems like if we can identify hearing loss earlier, it can play a big role in having reducing the rate of cognitive decline. And you can see some of the other risk factors that continue to matter later in life include smoking, depression, physical inactivity, air pollution, diabetes. And this is something that, when you see your primary care doctor, hopefully they are addressing in your annual wellness visit some of these things that can be modified. But 40% being potentially modified is something that is a lot of hope, a very hopeful message that I see over here. So this is just kind of aggregating whatever information that I just mentioned, that some of these factors actually help improve cognitive reserve if we are, something like if you maintain social contact, attain a higher level of education, learning new things at every age when you can, all enhance this cognitive result, which actually prevents dementia. So yes, 1 in 3 cases of dementia can be prevented by lifestyle factors. So this is one of the, Megan mentioned that I also work with the Heart Disease Association, which is the American Heart Association. And I did some of my early work in research with them. And the idea was to, again, show that we don't have to make very dramatic changes in our lifestyle, but if you even make a small change of increasing your physical activity, let's say by 30 minutes, or cutting back a little bit on smoking, it can actually do a lot of good. It can reduce the risk of death by 18%, heart disease by 23%, stroke by 8%. And as I said, I view health very holistically. So this something like that is, I feel, a very powerful message that I can avoid a lot of these conditions if I just make that small improvement in my lifestyle. If you're interested in something like this, you can go to a website called My Life Check, put in some of your data over there regarding your blood pressure, your cholesterol numbers, if you have it from your recent visit to a doc, and then put in your exercise levels and see where your number stands. And it'll give you a crude score, and you can try and see if you can make it improve. And then it'll give you how much of chronic disease you're going to avoid. So I feel like it's a powerful message that small changes on lifestyle can actually have big, you can get big reduction in diseases of all different kinds, including dementia. Now, we're here to talk about stress. So I got interested in stress because stress is, so common. I see patients struggling with this, especially over the past few years, have been rough on everyone, right? Now, the story of stress, you didn't see stress mentioned there in the risk, in the modifiable risk factors, but it's still there and affects everything. But the reason why stress is not shown up in the risk factors is because stress is a little bit complicated to study. And the reason is we know that a lot of patients with dementia or who start even having minor symptoms of cognitive decline, they start to experience stress. When you forget something, it's stressful. So whether the disease is causing the stress or the stress is leading to disease is kind of a hard thing to tease out. And that's why we need longitudinal studies. And stress, not only in the pandemic times, but even before that, it has been shown to be increasing over the past several decades, right? You can look over here and it just shows the stress scores, like the kind of thing you mentioned. It shows that in every gender, age group, race, education, the study was done at 3 time points, 1983, 2006, and 2009. You can see how the stress scores are going up. The mean stress scores go up for pretty much every group, right? So no group is kind of immune to how that we are generally living a much more stressful life compared to, compared to previous decades, right? But there's some groups that are experiencing definitely more stress. If you look at the mean stress scores, it seems like, African Americans have higher levels of stress scores, right? Women seem to experience and report more stress. So something to pay attention to as to why some groups are experiencing more stress. But in general, this news doesn't look very good. That why, despite every resource that we have over here, we are very stressed. So I want to talk about now stress in a little bit more detail of what I mean by stress, right? So you can think of stress as physical stressors, like, if you have like a cold, even just or any kind of illness, like, condition like diabetes, it just, you have to modify your lifestyle and that can be stressful, right? But there's also other kind of stress, like you have deadlines, and those are kind of psychological stress because you are trying to experience something different that can lead to some stressors as well. And then some major life events that happen that causes stress for a lot of people that stays on for a long period of time. For example, people going through divorce or having a chronic condition like renal disease, going on dialysis, right? That is a chronic life situation that you have to day in and out deal with it. So we look at stresses in these two different of these two different kinds, but the effect seems to be pretty similar on the body. So if you follow this complicated graph, what happens is when you perceive a stress, it sort of activates your body and you have this shallow breathing. You can imagine yourself the last time you were very stressed and think about how your body was at that time, right? You felt there was an emergency, your heart was pounding, your muscles were more tight, you probably didn't sleep well, and you probably also experienced fatigue for a number of days after that, right? And I'm going to show you some data of how stress seems to affect so many of our medical conditions, such as diabetes and hypertension, and why some people, are not able to cope up with them as well. And that leads to a lot of physical manifestation as well, right? So all these bodily effects, and then how we react to them. Do we get angry? Do we get more fearful? Do we avoid things? All this, how we react and cope with stress is a whole literature in itself. And it's fascinating because this is where I think we can intervene to try and avoid the negative effects of stress. And another way of thinking about stress, as I mentioned, is not only to think about the psychological as well as the physical kind of stress, but to also think that there's something called as good stress too. So if I were not to be stressed at all, let's say if I were to think that if I were at a zero stress level, I would have probably forgotten about that I have to come and give this talk because I wouldn't have remembered it. So we need a little bit of a stress to be functional on a day-to-day level, to remember things, to be engaged with things, right? And if I don't bring out my full attention with that positive stress, I would probably not do much in life, right? It just is as important, right? So there is that zone of what is called as a positive stress where you are functioning very optimally, right? You have your attention is focused, you're making more rational decisions and everything. But on the other hand, there are problem areas which is called the distress, where things just go out of hand, right? So if you have zero stress level, for example, you are probably having a lot of boredom, and that's not good for your health either, right? Um, and the other extreme is, of course, where you are in a state of heightened uh, excitement all the time, which can promote burnout. And any jobs you look at, that has become almost a norm, that people are in this heightened state of work deadlines and not being able to manage other conditions and or their work. It's just leading to traffic rage and stuff like that. It just comes out in bad ways. So we also want to differentiate between the good stress from the bad stress, and that's why this is also important for us to measure when we do these studies related to this. And also, if the experience of stress in a particular individual. So if you put one person in what is commonly perceived to be a stressful situation, you might find that there are some people who in the exact same position might behave very differently. So people's reaction to this external stimulus may be very different. And I think that is also a very interesting area to study as to what makes some people more stressed in any given situation compared to others. So as I mentioned, this is the why I want to do research in this area, because it's fascinating, right? And adapting to stress is also something interesting as we think about measuring stress, right? So when you have that alarm reaction, right, you almost at some point of time become exhausted when the stress continues to keep putting you at risk every single day, right? That feeling of exhaustion. So that is something also we want to measure, is like, why does, how is the chronic levels of stress affecting people and their health conditions? And there has been like several decades of research in this area, less so in dementia, interestingly, but in other conditions, we know that stress affects not only the way people's moods are. People with more stress are prone to, or who are not coping well with that stress, are more prone to have depression, for example. They have lack of concentration, right? They have more anxiety and panic attacks. On the cardiovascular system, it has had a lot of studies that have supported this, that higher levels of chronic stress can increase a person's blood pressure, increase the risk of heart attack, right? And also affects other conditions, including diabetes, which I'll show you an example of. And then it also affects the immune system. So think about the time when you were stressed and you just got a cold infection on top of it to make things worse, right? And there's actually real data to show that when we are dealing with stress that is affecting our body, it actually lowers the immune system. And that makes, of course, things worse, right? This regarding our gut, I think this is a common one people experience. If you have a flight you're going to take and you're uncomfortable with taking flights or any new experience, you get sometimes a stomach upset. That's a real psychosomatic symptom that happens because of stress, right? And other research has shown affects your joints, your muscles, and also lowers the bone density. And as I mentioned to you, over the past 3 decades, stress has increased. And you can imagine what is happening in my primary care clinic. It's like every second patient I see has something related to stress that is affecting and bothering them, right? It has just COVID-19, all the isolation that people had to do, things that they could not do or connect with their loved ones, has just worsened the epidemic of stress. In fact, I was looking at data from telemedicine. The most common cause of people using telemedicine service is for psychological help. I mentioned to you about diabetes. This is interesting because why would diabetes get affected with stress levels? So interestingly, studies have shown that if you have stressful life events, your diabetes prevalence just keeps going up. So stress in a lot of ways promotes worsening of diabetes controls. If you know family members who have diabetes or friends who have had diabetes, talk to them as to what stress do they have, because yes, there is a tendency to put medications after medications on them, but think about what is really making them prone to having worsening of their blood glucose control. And I can bet you the answer is stress, right? And this is the data I was wanting to show you regarding how the number of colds, like getting this cold upper respiratory infection, increase if you are having some kind of a chronic stressor. So this study kind of compared two groups of people, the blue ones without any chronic stressor, the red ones with some chronic stressors. And you can see the number of people who reported colds was much higher in the people with chronic stressors. And this has been shown in a lot of biomarker data as well, that the inflammatory markers go up, and that just and the immune response, that it just makes people more prone to having and worsening condition. They also take more time to recover if you have a chronic stressor going on. And we are all at the Emory Healthy Brain Institute are interested in aging and that people stay healthy, right? So interestingly, people who have had more adverse life events, it actually starts affecting your chromosomes. And you can actually see that in studies that have shown that it shortens the protective part of these chromosomes, and that leads to more rapid aging. So you can imagine people who have chronic stressors, and just are not able to cope with them, they actually sometimes even tend to look older. And that is actually, coming forward from these studies that are being done. Now, this is a very detailed, figure, but I wanted to just emphasize the fact that the stress affects a lot of our hormonal system and our immune response, which is what makes us prone to, this is an example from cardiovascular disease, but I want to, do my research in a way that I show something similar is happening with dementia too. And one of the things I feel like why African Americans, for example, have higher rates of dementia is probably they're also going through chronic discrimination that happens in different settings that make them more prone to accumulate more risk factors throughout their life course and develop dementia sooner. So something on those lines, I feel like is as relevant to dementia as cardiovascular diseases. This is again how stress scores can, accelerate cognitive decline and lead to mild cognitive impairment. This is a WHO study that was done. You can see the higher levels of perceived stress score were related to mild cognitive impairment. And I'm just completing off a study, as I was mentioning to you, it's kind of hard to disentangle as to what came first. So I decided to look at a major study being done in from Alabama, but it has centers all throughout the United States. I don't want you to get lost with these numbers over here, but the point is this, that even longitudinally, so stress is coming first, and then we are looking at cognitive decline happen later. The study is emphasizing this point again and again, that stress can lead to cognitive decline, chronic stress. And this is also showing that once you develop cognitive decline, your worsening of cognition can happen if you're more stressed. So even after a person develops some cognitive impairment, having more levels of stress will actually make their cognition decline even faster. And you can imagine this, that when we are so stressed, our brains are almost hijacked in that way, and we just can't cope with things. And it just we find it difficult to remember names, to remember things, and that just makes everything worse. And I mentioned to you that this could also explain the role of stress, particularly in some subgroups. People living in rural areas, for example, I feel they go through more stresses in their day-to-day life. People from certain racial and ethnic groups. I mentioned the example of African Americans, right? So that discrimination related stress is also of interest to our research group, because just like what happens to these population subgroups, that they have a heightened risk of heart disease, we feel a very similar story is playing out for dementia as well. And there's been already some reports that perceived discrimination and is related to cognitive decline in older African Americans. And we are doing some studies related to people living in rural areas and how they might be more vulnerable for developing cognitive decline because of day-to-day stressors. So as I mentioned, I always, we talked about stress, but what can we do about it? That's an area of my interest, and all things that we can modify. So one of the major studies that actually came out a few years ago was this study called the Finger study. It was really looking at how an intensive lifestyle intervention, something very similar of what is offered in our cognitive empowerment program, of nutrition, more exercise, some cognitive training, and vascular risk monitoring, compared to just regular health advice. Like, how did it change things? So this is the hopeful news that came out, in that when people who went into that intensive lifestyle group, their cognition actually showed 25% improvement. Their memory function improved, their processing speed improved. Now, these are different kind of cognitive tests that measure different aspects of memory, right? And look at this, the cognitive chronic conditions declined 60% lower than compared to people who just got education. So when I see patients, I educate them, but I feel like I'm not very effective there, because education by itself is not that helpful. We really want to get people into doing some kind of a program such that they can really get benefits from changing their lifestyle. And that's what I'm interested in. Now, I mentioned to you that we all kind of, if you have participated in Brain Talk Live, as well as you have attended CEP communication programs, we know the importance of lifestyle. The problem is, why does it fail? I think that's the interest area of mine, is why is it so hard to change our lifestyle? We are so set in our ways, and we want to understand what would it take to make that small tweak. And I mentioned to you before that even the small tweaks can give a lot of benefits for all sorts of chronic conditions, right? When we have data to show that 80% of people actually fail to maintain their New Year resolutions by February, by the next month, right? And the problem happens from a lot of areas where psychologists are working through, is that we either set very unrealistic expectations, put wrong goals of things that we don't like to do. We put on, taking on a diet that we feel like we're really not enjoying it, or we don't have just company, and exercise to us seems boring, right? So, and that's the area that I'm interested in, is how can we make lifestyle change an exciting thing, such that it is not only, you like to join the group, but also stay on, and that once the group ends, you are still carrying on with that because you're experiencing the joy of lifestyle change. And I'm looking at, working with psychologists a lot, but actually a major economist, Daniel Kahneman, actually talks a lot about health behavior. And he talks about thinking in two different ways. The one is a very slow part of the brain, which reasons, which reflects, and is deliberative, right? So, and the other part is more, which sort of hijacks our brain, is more impulsive, automative, and associative. So if you think about times when you just take a reflex decision and eat a chocolate cake, we want to try and shift some of the slow thinking to times when you're making these decisions, right? because what happens is those fast, and we need that fast side of the brain, because if some animal attacks you, you want to be also not be in a slow mode and be bitten, right? So you want to have this fast side of the brain. That's actually, it has been shown that we have had that kind of a like a brain side since the early ages, right? But when it's to activate your slow part of the brain, where you, as soon as you see the chocolate cake, instead of the fast impulse reaction, you shift and slow down the process and then think about it, and then you decide, do you still want the chocolate cake or not? So that kind of thing is what we're trying to incorporate in our intervention studies, to understand how we can improve people's health behavior by putting them into a more slower zone when it comes to these decisions, right? And change is definitely a process. It's never an event. So you can decide on a new year goal. You might work on it for some time, but it fails because it has to be seen as a process. So you have to think about that every small step. I emphasize the importance of even small changes that can make a big difference in chronic conditions. So celebrate that small success when you can, right? And these are some of the other good things, be consistent and, try to change one thing at a time. So I often ask my patients, right, what is the one thing, good thing you did for your heart and brain today? And common times it could be a lifestyle thing that they did that actually helped them. Did you take the elevators or did you try to take the stairs? So as simple thing as that can help, right? And of course, tracking your progress. So sometimes what you measure really gets done. So if you don't measure something, you are not going to know where you are at. So I think tracking, yes, it can initially bring on some anxiety that, oh, I have to do this. But actually, it really is important to measure your progress and then celebrate the accomplishments you have, right? And then again, learning from your mistakes and why some setbacks happen and why you again went into that phase is all of interest in trying to change behavior. So again, protecting brain health, heart health, all go hand in hand, right? And the key factors you have heard about in all these talks, it's all about healthy eating, regular exercise, and getting adequate sleep. That's the other big one. So people who are stressed don't sleep well, and this having less sleep has several other chronic effects. So our goal is to keep understanding the role of how we can, help people manage their stress better, and at the same time, adopt to a more healthier, less lifestyle in small doses, right? And this contributes to, having that good life and a meaningful life contributes to life happiness, which I have already mentioned to you, helps in cognitive reserve, right? It just, having that meaning in life is so important, right? And yes, sometimes major events in life happens, like marriage, that, and they can temporarily, make us move away from our goals, but a lot of people are able to rebound back, and that's where resilience is tested. So measurement of stress along with resilience and coping is what we're interested in. So one of the things you can do, it's, you don't have to, for most people who are working and, have so many responsibilities, you don't really have to sometimes set aside a lot of time, which is, the biggest problem with a lot of people. When you ask them, okay, what did you do to change things? We don't have time, right? It could just start with doing something mindfully, right? And again, then people think, oh, I have to attend this yoga class. Do I have to attend this thing? No. Well, you can really, even while driving, you can pay attention to different things and basically incorporate all your 5 senses. So I like this exercise because, when you take your morning cup of coffee or tea, just think about what you're seeing around you. If you're seeing a sunset, sunrise, well, if you're in the morning, you're seeing a sunrise, some plants around you, all the things that are in your kitchen, you're just paying attention to them, right? Hearing the sounds around you. Sometimes they're birds chirping, any song that you might be playing, or a news radio that you're listening to. Hopefully it's not news of politics that can make you more stressed, or even just the silence, like, just paying attention to that silence, right? So taking in the smell of the drink you're having. If you don't drink coffee or tea, whatever drink, even if it's, some kind of a smoothie or something, right? And then holding that cup, if it's warm, cold, getting the temperature right, feeling the temperature. So all these senses as you're engaging them, and then you're taking that first sip and you're trying to really enjoy that drink. That, if you just do that, you've already practiced mindfulness for the day, right? It works like a prayer because you're really focused in that moment. You are there. And that small activity can just set you well for the rest of the day, right? And again, do good for your heart and your brain, right? But other ways to cope with stress, there's this nice website called De-Stress Monday. I would recommend going there and checking out all the different resources that they have. Is sometimes when you get stress is to not be in denial of the stress, but to acknowledge that, okay, it's exceeding your capacity to manage it. So, so to acknowledge stress is very important. And sometimes there's stress you can avoid. So that is definitely, if you can do that, go for it. Because if you can avoid a particular traffic area and take a road with a less traffic, that is a good way to manage it. And then trying to alter and adapt it, right? So that could depend on your sometimes work situation. Can you change the kind of job which is not giving you much joy? Can you change that? Can you ask your supervisor to do that? I think that helps, right? And then accepting it and then building up your coping skills with things that we just discussed, like deep breathing, mindfulness, and things that people are learning in cognitive empowerment program and other programs out there, right? So indulging in that self-care is very important. So, I talked about managing stress, and, and I'll just conclude by saying that we all know about this, that dementia, poor mental health are global pandemics, right? They are not just COVID, but these are real problems that a lot of people are facing. But think about things that can be modified, and that includes a lot of these lifestyle factors that I just mentioned. Don't forget about chronic perceived stress. So recognizing that you have stress, I really admire people who posted their scores as 9 or 10. That's the first step. You're acknowledging that you are stressed. And the next question to ask is, okay, what can I do about it, right? I mentioned to you that this leads to health disparities of different kinds, and we need to understand why, what can be done about them, right? And my interest area, as I would mention, is in trying to improve people's lifestyle through stress reduction and other things. I am actually going to closely working with the cognitive empowerment program to understand about how stress is related to cognition. Our plan is to measure some of the, we might give you some devices to see how things go during the week. And for people who are not able to participate in the cognitive empowerment program, some of our prior intervention work has actually been done remotely, right? But we like to do things in group because I feel like that's powerful when people are able to exchange their own great achievements with each other. There's something powerful about doing these lifestyle interventions in a group setting, right? So we have programs for that. If you're interested, please contact us, and I'm happy to give you more information. With that, thank you again for listening to me, and I would love to take some questions. Thank you.
Yeah, that was so great. It's so lovely to hear the support for doing these changes slowly over time, and I think that that's so important, is thinking about these small changes. Sometimes at CEP we say one drop in the bucket at the
Yes.
time, and slowly over time these drops add up and add up. So we did have some questions come in from the chat, which I'm going to give to you, but I just wanted to stress a few of the different things that you said. And one thing is this idea of learning new things, that there is something to learning new things in a social setting, in a support group, in a support system. And we always say at CEP, like, to make it fun, that there has to be something about it that is fun and enjoyable. And so I just love that you mentioned that, because it really does help to have the things that you're doing that are supporting your health be things that you enjoy. And so finding ways to do that. And another thing that you brought up, I thought was so great to re-mention, is the correlation between stress and exhaustion.
Yes.
And we just have so many of our participants report sleep as being something that they are suffering with. And also reinforcing that making appointments and telling your primary care provider that is so important. So that's one of the things that kind of gets left off the table sometimes when we make appointments and we don't bring these things up. But it's something that can really help with some of the sleep issues. So anyways, reiterating some of those there, but we had some questions from Jim from the chat. Um, have we learned about a little bit more about the importance of our genetics in who suffers differently with the same disease? And how can we pry more into this idea of, being the one in the one third that can make these lifestyle changes versus some of the genetic factors?
I think that's a great question from Jim. What I would say is that, yes, there are some people, if we do a genetic test, we can kind of get an idea that they are more prone to it, but it's not a definitive test by any means. And I think that's where Dr. Alan Levy's major vision is how can we get more and more precise about who is going to develop dementia? It's an active area of research. There's a lot being done for it, not only just the role of genetics, but there's this whole area of science that has evolved, which is about epigenetics, which means you have these genes, but is their effect throughout the lifetime is not the same. It just changes with different things. That I was mentioning, the telomere length, it changes. It changes throughout the life course, and, again, I feel like, yes, you might start off with a slightly higher risk because of family history or something, but there's still a lot you can do throughout the life course that can modify this. So active area of inquiry, but the whole area of precision health is just, we are doing research to answer these kind of questions. So I'm very excited about precision medicine and everything because of that reason.
Yeah, and you also brought up, discrimination in health and discrimination related stress in these issues, and knowing that you are some part of these groups that are being identified more often than others, to really sort of be aware of what tests to get, when to get them, and the lifestyle changes you can make that are so easy. Mona in the chat asked, are there any differences in the effect of lifestyle changes for early onset dementia versus later onset dementia?
Great question again. Let me answer the first part of what one thing you were mentioning about discrimination. I think we frequently see discrimination as from the lens of race, right? But I am interested in discrimination of all different kinds, because people who are overweight or obese, they feel like they're discriminated every single day in getting jobs. People who are in rural areas, they feel they're discriminated again when they go, and trying to, get something in cities, right? It's just discrimination can manifest in several different ways. So I think that's an important area of inquiry, and we try to capture a range of things that people might feel discriminated against, right? So that's that. Now, with regards to how lifestyle changes, so the one thing about early onset dementia versus later onset, the early onset one seems to scare a lot of us, because even though it's not that common, but just the idea of someone getting dementia at the age of, early 60s is just scary for a lot of us. It does have a lot more role of genetics to play, why some people develop that. Now, whether or not it can be modified by lifestyle changes and can you delay the onset is, again, an active area of inquiry. But there's a lot of studies being done. Actually, just like the finger study, there's a major study being done called the US Pointer study. And that's looking at people who are high risk because of their family history. What if we subject them to a lifestyle program? Can this risk be modified? So, you're asking questions that are going to become future major papers, right? So yeah, I can see the questions actually. So I'll go to the next one. Can one suffer short-term stress without severe issues? Example could be illness of family members, short or long-term. Well, it is how we deal with stress is, I think stress is very common. When I ask people, are you stressed or not? It's also testing their coping skills, right? Because the same stress, another person could just take it in an acute way and not have any chronic problems, but another person would have chronic issues, stress issues related from the same life event, and that's our individual response of how we have been trained in managing stress from our childhood, right? But I think it can be modified. I think that our reaction to stress is an interesting area of how we can actually change it, right? It takes time. That's why some people, when I refer patients to see a psychologist, is that's what they're working on. Because somewhere there is a little bit of a malalignment in how you're dealing with stress, and medications can do great in all the biochemical things I was sharing, but the psychologists help to correct that pattern of negative thinking, and that's why they're so helpful. It takes time, but it can be done.
And investing in the counselors and social workers and all the people on your care team.
Yes, and I think that's Cornelia. So hi to Cornelia. You're awesome. It's always nice to see her. If you would like to make sure, okay, this is from you. Okay, this is a question from Ellen. I've lost 50 pounds in the past year. I thought it was changing and watching sugar. Great. As I said, when you measure something, what gets measured gets done. That's one of my favorite quotes. But then I signed up with Noom. Okay, Noom is great. And some things are very well known to work, but everyone figures out their own way of what works for them, right? But she shares this. But the big reason I think I've been successful after over 30 years of being overweight. Now that's great, right? I don't want to have knee replacement surgery, and my surgeon told me the best thing I could do was lose weight. It went into my brain, and in ways it hadn't before. I still have more weight to lose. This last plateau, it's been hard to stay positive. Just want to share some of my experience. This lecture has validated so much of my experience. This is the kind of story, which is why I like group intervention, is that when people share these successes, me as a physician, probably, or as a facilitator, I don't do much. It's, I feel like my job is done when I bring people together, because their own personal experiences of how they overcome some of these challenges is all it takes to make some of our lifestyle interventions so successful, right? And I think I appreciate all these messages. Thank you. And I'm happy to leave my email if you want to reach out to me. We can, I shared the studies contact number. If you're interested, and I can paste that again, give me 1 second. But we'll be working very closely with the cognitive empowerment program. So stay tuned for that. Here's my research coordinator. As I mentioned, this is all about my why. Like why do I want to make a contribution in this area, is because it's so powerful if we are able to get this message out. So thank you. Maybe a better quote is, don't expect when you don't inspect. I love that one. I'm going to write this down. Thank you, Gary. See, as I said, when I give these talks, I learn more. It's always enriching for me. So thank you very much. Any other questions? Anybody who wants to bring up? We have a couple of more minutes. I don't know if Megan has any announcements.
We're so grateful for all the information. Everybody's been so excited in the chat and so supportive of your presentation. And, Dr. K did put his contact information in the chat. So if you're looking for that, there's also the program coordinator's phone number there in the chat. So feel free to write those down. And we will post today's video to YouTube if you want to go back and look at any of the information that we shared. If you have any questions that come up, bring them back to the table here at CEP Live. Next week, we'll be getting into a lot of the putting this talk into our walk, because next week we'll be having physical activities with Ayatoni. We'll be doing a 45-minute workout that's designed with a lot of dual tasking, not just to get your heart rate up, but also to get your thinking and some of those cognitive lights firing. And after that, we'll do Tai Chi with Tina in the week that follows. So really figuring out, physical ways to lower stress through some of these breathing exercises, cognitive meditation, a little bit of mindfulness. Mona says, I love his workouts. Yeah, Iotoning's the best. And so in the next month here in November, we're going to be doing workouts all month long. We'll be off the week of Thanksgiving. We'll have yoga when we get back. So be sure to join us and be sure to connect with some of these research studies. The more that you get involved, the more empowered you will be to make these lifestyle changes. The more that you get the information in your hands, the easier it is to start tracking some of these small changes over time. So if you didn't get the contact information, it's akulshr@emory.edu. So we got a lot of thank yous coming through, Dr. K. And thank you for sharing your information with us. A lot of people in the chat said in a way that was accessible and digestible. So we really appreciate that.
Thank you so much, Megan. I appreciate all the feedback. And as I said, if you know of places where we can give these talks, because we want everyone to benefit, right? So we're happy to spread the message and learn. I make it a point to try and enroll more minorities in our research studies, because we can only understand about what's going on and how we can help if we, get people to participate in studies, right? So that is a great contribution to science and understanding about health.
Thank you. So reach out, enroll, stay involved, and we'll see everybody next week. Thank you, Dr. K. We really appreciate it.
Thanks very much. Take care. Thanks
You
all.
too.